We're going to get started now with Dr. McKellar. And of all the weeks that my foot decides not to act up, it's acting crazy. So I probably will trap him somewhere during the day because that might help me get off this cane. But anyway, and so today he's going to be speaking about foot care with a podiatrist. It's a really great presentation. So we got a chance to see it last week at Thriving Thursday. So without further ado.
Better? Okay, thanks for the input. Thanks for coming out. Looks like the appropriate crowd to say Happy Mother's Day too. Hope everybody had a good day yesterday. We'll go ahead and get started. I am Dr. Travis McKellar. I'm originally from the Utah area. I did my undergraduate training at Utah State University and then some more at BYU, Idaho. After undergraduate, I went to Kent State University up in Cleveland, where I did my podiatry training. After school, I went down to Texas, at a little town called Temple, where I did my residency. Following my residency, I did some more training and working with an orthopedic surgeon in the Austin area. I was with them for about a year and a half. And then I've been up here for about 3 months, 2-3 months seeing patients here. Living over on the Ohio side, but I'm new to the area and it's been great so far. Been a good change for me and my family and we're really liking it here. So throughout the years of going into podiatry, a lot of patients ask, why did you get into podiatry? And I can honestly say, a love for public speaking has never come up. This isn't what I do. I tend to sweat, so I got a handkerchief to wipe my face off. As I'm doing that, just ignore it and just watch up here. Okay, but I'm glad to be here. A little bit about me. I've got 3 kids. This picture up here on the top left is one of my favorite pictures we have. This is back when they all liked each other and they just randomly held hands as we were walking through a park together, and now they just fight, but they're still good. Here's some more photos. Top left is up in Lake Erie, bottom left at a river in Texas, and then on the right, my daughter wanted to help me redo the tile in our bathroom, so here she is grouting the bathroom tile. We like to be active as a family, go hiking. We go on a lot of mountain bike rides or just going on walks. We like to get out and have some fun. One tradition that I started with my family was gingerbread houses, and one year I made a gingerbread house and the kids really enjoyed making it. Turns out they all hate gingerbread. But then they didn't want to do a family gingerbread house. They wanted their own houses, but they don't want gingerbread. So now I make 3 sugar cookie houses and we decorate the sugar cookie houses and they really enjoy that. And here's my kids with their sugar cookie houses they made from last year. So that's a little bit about me. I'm glad to be here even though I'm sweating. So we'll go over some common foot concerns that people have, and then after we'll take some questions. We'll talk about heel pain, which is fairly common. When I was down with the orthopedic group in Texas, I would say probably about 30% of the patients I saw were for heel pain, and doing some simple things. They could avoid to come see the doctor if they could do some things. Other things, toenail changes. We'll go into some diabetic foot care. I don't know if there's any diabetics here. I'm sure there are, or you have family members or friends that are diabetics. We'll go over the importance of maintaining your feet as a diabetic. And then some bunions, hammer toes, and other things that we do. So heel pain. Heel pain comes in all sorts of different areas on the foot. The one we probably see most often, and I'm sure a lot of you have heard of, is plantar fasciitis. Another thing is Achilles tendonitis, insertional Achilles tendonitis, stress fractures, and bone spurs. All of these essentially boil down to either your calf is too tight or you're being too active. And we'll get into that a little bit more. So some anatomy of the foot. We got our calf muscle that comes down and inserts on the back of the heel. And then on the bottom of the heel, there's a band of tissue called the plantar fascia that stretches across the bottom of the foot and inserts on the toes. With plantar fasciitis, that's pain at the bottom of the heel. Most patients say it's worse in the morning, that first step they get out of bed, and it's really painful on the bottom of the foot. If you're feeling that, you probably have plantar fasciitis. Achilles tendonitis is obviously pain in the Achilles tendon here. That can just be random pain throughout the day that comes and goes, worse with activity. And then we have insertional Achilles tendonitis, which is very similar to plantar fasciitis, where it's pain first thing in the morning, those first few steps, but that's on the back of the heel. And I've actually been battling this insertional Achilles tendonitis over the last couple of weeks, and it's been terrible, but it's getting better doing some simple changes to my routine, and it's getting better gradually, but we're getting there. Calcaneal stress fractures, obviously a fracture of the heel bone or the calcaneus. That's from too much activity too quickly. And then bone spurs. Probably 70% of people that we take x-rays of have some sort of bone spur. And a lot of those patients were told years ago that they have bone spurs. And I don't know why, but when patients hear that they have a bone spur, that's all they remember from the doctor's visit. Someone will come in and say, I was told 12 years ago I have bone spurs and that's what's bothering me. When the truth of the matter is the bone spur is hardly ever the source of the pain. It's just a sign that some sort of tissue is pulling too hard on the bone. If you have a bone spur on the back of the heel here, that tells us that your Achilles tendon is pulling too hard on the back of the bone. If you have a bone spur on the bottom, your plantar fascia is pulling too tightly. Very rarely is a bone spur going down or towards the weight-bearing surface. If we see that, then we think, okay, this bone spur is painful. The other ones usually aren't the source of the pain. It's just a sign that something else is going on. So if you've been told you have bone spurs in the past, you can just forget about them. It's just something else is going on, okay? So with heel pain, you can see I got the things on here, how to prevent heel pain. Step 1 is to stretch your calf. Step 2 is to stretch your calf. Step 3 is to stretch your calf. Avoid barefoot walking. Wear well-cushioned shoes. And if you're going to start a new exercise routine or you're getting into something, gradually increase those activities. Don't just go for it. I'll go back to that last slide. So why we want you to stretch your calf. The calf muscle comes down, inserts onto the heel bone right here. The plantar fascia shares the heel bone as an insertion point. So if this is tight, it's wanting to pull your foot or your toes down like this just by pulling this motion up. And then it makes it so everything on the bottom is tight when the ground is pushing up on the toes. You got counteracting forces across the foot. We can't really do anything about the force of the ground. You have to live your life. You have to walk. We can't do anything about that to a point. But what we can do is we can work on our calf range of motion. We can work on stretching that calf so it's not pulling so hard, which in turn reduces the pressure on the bottom of the foot. That's why stretching your calf is important. So over here I just have some different stretches that you can do, typical runner stretches where you lean against the wall. Other things that you can look up, or if you need help, you can come in and talk with us, or family members that run, they can tell you some good stretches to do, okay? Other common things that we see are toenail changes. Toenail changes happen for a lot of reasons, and I've got some on here. Fungus or other infections, with fungus being by far the most common. Toenail fungus, or the fungus that causes these changes, it's all around us. It's in everybody's house. It's probably somewhere on our feet at all times, but it doesn't really affect everybody's toenails. There usually has to be some sort of trauma to the nail just to make it a little bit loose, so then that fungus can get underneath and seed into the toenail, and then you'll start getting these changes. There are some medications that we have for that. There are some topical things that can work well. It really is a pain to get rid of toenail fungus once you've got it, but we have some things that can work or certainly reduce the fungal load that you have on the toenail. Other things that cause toenail changes, acute trauma. If you drop something on your toenail and the nail comes off, it could damage the nail bed. So as a new nail grows in, it can be wavy, or that nail can be thicker, and it can forever be that way. Sometimes it can get better over time. You can try removing that toenail and see if a new nail grows in and doesn't have those changes. But so an acute trauma can cause that. Repetitive trauma. If you're wearing shoes that are too small, or you kick the wall a lot, if just constantly hitting your toenails against the inside of your shoe from a shoe that's too small can cause your toenails to get thicker. And then also aging. We see in older population that a lot of them have thick toenails. There's a protein in the toenail called keratin that it reproduces and changes over time, but as we age, that doesn't happen as frequently, and so the nail gets thicker because it's not repairing itself as quickly. So just because you have toenail changes doesn't mean you have toenail fungus. It could just be you're getting a little older and the nails aren't replacing themselves as quickly as they were. And then another thing we see frequently, mostly in younger population, young kids or men that are about 20 to 40 years old, or ingrown toenails. If you've got redness, pus, soreness on the side of the toenail, you could have an ingrown toenail. Come in and see us and we'll help take care of you. Any of these things, come in and see us, we'll help take care of you. Managing difficult toenails. The most important part of managing toenails that are hard to trim is to actually trim them. Can't tell you how many times I've seen patients come in that they haven't had their toenails trimmed in a long time. No, you're fine. I had one patient come in that had been 2 years since we had seen him, and I said, well, who's trimmed your toenails since we saw you last? Nobody. He hadn't trimmed his toenails in 2 years. And that, I don't know how you put shoes on like that, but it's not terribly uncommon for us to see someone like that. So if you have difficult toenails, work on trimming them. If you need a medical provider to do it, like myself, or to come into our nail clinic and have one of our nurses trim your toenails, you can do that. You can come, we can help you out. People that should have their toenails trimmed by a medical provider, somebody that has a history of a toe amputation or a foot amputation, if you have really bad peripheral arterial disease and you've been told you don't have the best blood flow to your feet, come and see us. We'll help trim your nails so you don't accidentally hurt yourself. Or if you think you have an ingrown toenail and might need a procedure, come see us. If you're able to trim your nails yourself, some tips on how to do that: get the appropriate equipment. I kind of like this picture that's on here that I found on the internet, because this is supposedly a medical provider cutting this person's toenails, but they're actually using a tissue nipper for skin and not for toenails, and I thought that was kind of interesting that this is the picture they had. But make sure you have an appropriate nail nipper. The nail nippers or nail clippers that they sell at the stores, I don't know who invented those things that are terrible, especially if you're getting thicker toenails. They have other things that look like wire cutters that are much better for cutting thick toenails, and you can buy them at any beauty supply store, or Amazon carries them. I said they look like nail cutters, but I don't want you using nail cutters. We have a lot of patients that are cutting their own toenails with wire cutters. It's like that's just waiting for an accident to happen. So get the right tools, get a lot of emery boards, and file your nails thin to make them more manageable. Other things to do: cut your toenails after you take a bath or after a shower. Let the water soak in there and make that nail plate nice and soft and more manageable. Do a foot soak before you're going to trim your nails. Also, this Urea 40% lotion. There's a lotion on Amazon. If you just search Urea 40%, you can get a big tub of this lotion for about $10 to $15, and you can just put that on your toenails every day, and it'll make them a lot softer and a lot easier to trim when it comes time to trim your nails. Another thing is, if you're going to do it by yourself, having a date night or a friend night. Lay down and work on each other's feet. If you don't need your nails trimmed, you can get a foot massage. Let the other person while you're working on their nails. And then we'll talk about diabetes. So how does diabetes affect the feet? Your blood sugar is elevated, and that just causes havoc on the entire body. It attacks nerves, blood vessels, skin, attacks essentially everything in the body. And what it does to the foot, makes it so you can't feel as well, makes it so you don't have as good blood flow, makes it so the skin isn't as pliable as it used to be, plus you have a decreased immune system. So what happens is someone can't feel their foot, they'll step on a nail or a rock, or just walking, they'll develop a callus, they can't feel that callus, they develop a little tiny wound, they again don't know they have that wound, but they also then don't have blood flow to heal that wound. Plus they have decreased immune system, so there's a wound that then gets infected, and it can go bad quickly. If you're a diabetic, we'll go over some things that you need to do. If you have family members that are diabetic, some things that they should be doing. But it's really important, because 80% of lower limb amputations in the United States are due to diabetes complications. So it's very important. So we look at this foot. Some of you may have feet that look like this, have some calluses, callus on the tip of the toe, and you feel it, and so you change the way you walk, you get softer shoes. A diabetic may not feel that this is a callus or this is about to turn into a wound right here. And then it ends up going to somebody like this. Just a small little wound that can turn to an infection and goes real bad. And you think, oh, he's got a below knee amputation, that's all it is, he'll be okay. The recovery time from getting a below knee amputation it does a lot to your body. It's months and months and months of in a wheelchair. Your body gets deconditioned, you're not as strong as you used to be, and so by the time you actually get to having a prosthetic leg, you're a lot weaker than you were before this happened. So it's not just a prosthetic leg and you're good to go. There's a lot of rehab to it, so we need to avoid this at all costs. So if you have diabetes or a spouse that has diabetes or family members, here's just some important things to always remember. Never walk barefooted, and that includes just wearing socks. I can't tell you how many patients I say, don't walk barefoot, and say, oh, I wear socks all the time. That to me is the same thing as barefooted. If you're gonna step on a nail with a sock or without a sock, it's still gonna hurt pretty badly. Have a shoe on. Have a good pair of house shoes that has a good sole so you're protecting your foot from anything that you might pick up in your house. Second, a simple thing to do is wear white socks instead of dark socks. The reason for that is if you do develop a wound of some sort and it's draining onto your foot or your sock, and you take your sock off at night and it's a black sock and you throw it in the dirty clothes, you're not going to notice there's anything on there. With a white sock, you'll notice, what's this yellow spot on here? What's this little red spot on my sock? And maybe you'll look at your foot and find a little change to your foot sooner than you would have if you were wearing a darker sock. Next, avoid poor fitting shoes. That one should be fairly obvious, but unfortunately it's not. We see a lot of people that are wearing shoes that are too small, or if they have some sort of deformity, whether it be a bunion or a hammer toe, and they're wearing shoes that have leather details across those bony deformities, and it's just pushing and causing pressure there. Wear shoes that are comfortable, that don't have leather details on the top. That way your foot can push the cloth fabric of the shoe out of the way rather than the shoe trying to push your foot out of the way and cause a callus or some sort of wound. Next, check your shoes prior to putting them on to ensure that there's no foreign objects in the shoe. If you have grandkids or kids or pets in the house, sometimes dogs like to hide chew toys in shoes. I've seen a guy that had a bouncy ball in his shoe all day long from one of his grandkids, and he didn't know it was in there because he has neuropathy, and so he's walking around all day with a bouncy ball in his shoe, and he takes his shoe off at night and he's got a new wound. So it can be really bad. So simple thing, before you put your shoe on, just tip it over real quickly and make sure there's not something hiding in there. Next, check your feet daily for new changes. If you can't see your feet, have someone else look. If you don't have anyone else, do what this cartoon is doing and use a mirror. Another thing is check the temperature of your bath water with your hands and not your feet, especially if you like to have your water heater turned up way too high. I have seen people that stick their foot in the bath and they scald their foot, but they can't feel it, and they don't realize the water's too hot until they go to sit down and their hand touches the water or something else touches the water and they realize, I've burned myself. And if you have any concerns for diabetes, any issues at all, come see us. We are happy to help take care of you. Other things that we do, bunions and hammer toes. We see a lot of bunions and hammer toes. A bunion and a hammer toe is not just a bump that's randomly forming. It's an angular deformity. If you look here, this toe is nice and straight. This toe looks like it has a bump that's forming right here, but actually this bone is swinging over this way and this toe is drifting over towards the second toe. It's not just a simple bump you go and shave off. It's a deformity of the positioning of the bones. Next it says pain. Do you have a bunion that causes pain? Maybe you need to do something about it. If you have these bony deformities and they don't hurt at all, Who cares if you have those bony deformities if they're not causing you any issues? I have a lot of people that come and say, I have this bunion. Well, does it hurt you? No. Then we don't really need to worry about it. If it causes any issues, there's something we can do about it, okay? Calluses. Things that we can do with the bunions and hammer toes, you'll get a callus sometimes on the side of the toe or the top of the toe. Just do some padding, shoe gear modifications or changes, like I talked about, wearing a cloth-topped athletic shoe or an open-toed shoe rather than a closed leather shoe or a shoe with leather details. Just avoid pressure and you can avoid a lot of the pain with the bunion. And if it needs to, we do have surgical corrections that we can do for those. Next, neuropathy. Neuropathy, random burning, or your foot feels like it's on fire, or there's pins and needles, or it's painfully cold, or electrical shock feeling. All these describe neuropathy. Neuropathy has a lot of different causes, and I have some listed here. The most common that we see is diabetes. Chronic alcoholism can cause numbness or neuropathy in your feet. Nutritional deficiencies, like vegans are deficient on B12, and so they start to get some numbness in their feet. Trauma or low back issues is fairly common. Hereditary, if your mom had neuropathy in her feet and didn't ever know why, and you've got it, well, that's probably from your mom. Environmental issues, systemic diseases, or tumors can all cause these nerve sensations in your feet. Now, treating neuropathy is very difficult to do. We can help manage the symptoms and make it feel better, but as far as getting it to completely go away, very difficult, if not almost impossible. But the most important thing is we've got to control the underlying cause of neuropathy. If you have uncontrolled diabetes and your feet are tingling from that, you got to get better control of your diabetes, or that tingling is never going to go away. If you're a vegan, you need to get a sufficient amount of B12. If you have low back issues, see a spine surgeon or see someone and get that low back pain taken care of. If you don't take care of the underlying cause, there's no chance it's going to get better. Once you manage that underlying cause, we can then do some medications to help decrease the activity of the nerves, kind of lower how much they're firing. And also we can do some vitamin supplements to try and help your nerves correct themselves. None of these are really great at helping that nerve pain go completely away, but we can help reduce it quite a bit. Other things that we do as podiatrists, if you have a flat foot deformity that is painful, we can do surgery to correct that. This is actually the case I did just a couple weeks ago of a lady that had a really bad flat foot deformity that we went and did surgery on. If your arch is too high, we can correct that or give some different orthotic or shoe recommendations to help with that. We also do tendon pain, ruptures, bony prominences. If you've got ankle pain, whether it's chronic or acute, we can help take care of that. Soft tissue lesions or foreign bodies. Last thing I'll talk about is things to look for when purchasing shoes. I don't care what brand of shoe it is. Most shoe companies make good, at least a model of good shoes, and a lot of shoe companies make a lot of terrible shoes. Women tend to be more guilty of this, of wanting to wear the cute shoe rather than the shoe that they feel best in. So keep that in mind when you're looking for shoes. How's my foot going to feel when I'm wearing this, rather than how's Susie going to care what my foot looks like. So things to look for in buying a shoe. When you pick up a shoe and you go to bend it in half, side to side, or front to back, where does it bend? When we walk, our toes kind of bend up a little bit. The rest of the foot is stiff. So if you can take your shoe and just fold it in half like this middle picture down here, I mean, that shoe's not going to give you any support at all, and your foot's probably going to hurt you. If you're twisting the shoe side to side, does it twist way too easily? If so, that doesn't have any side-to-side stability. Could make you prone to having some tendons being overactive and cause some issues on the outside of your foot. And then how firm is the heel or the counter? If you can grab the back of the shoe and just completely collapse the back of that shoe very easily, that doesn't have any side-to-side support. So we want a shoe that's stiff on the heel, hard to push down, only bends at the toes, and doesn't twist real easily in the sole. I have some different shoes on here that you can look at and wonder which shoe is going to feel better for someone that has foot problems. This shoe that's got a lot of cushioning and is really firm, or this shoe that you could hide and put it in your pocket and no one would even know it was there. So if you're wearing nice, I can't tell you how many times someone will come in and say, my feet are killing, and you look at the shoe on the ground next to the bed and it's like, yeah, I believe it. You're wearing just a piece of cloth as a shoe. We need some good support. All right, that's all I've got for you. This is a little vacation I took my 2 youngest kids on to Washington, D.C. last month. I really like this picture up here of my son in front of the mummy. He thought that was kind of freaky, but. All right, any questions from anybody? Yes?
What causes ingrown toenails?
So ingrown toenails can be caused from a lot of things. Hereditary is common. We see a lot of people say my parents had ingrown toenails and now they've got ingrown toenails. Shoe gear that is too narrow. If you're wearing pointed shoes, that can just cause the toes to cram together in there, and then the tissue on the side of the toe gets pushed up against that toenail and the nail grows into it. Probably shoes would be the most common in elderly people.
How do you treat it?
So I would see somebody about it. If it's recurrent, if you notice drainage, we can do toenail procedures. If you also have thick toenails and your toenails are difficult to trim, I often recommend just removing the entire toenail. Do a procedure, put the toe to sleep, and remove the toenail. It gets rid of the ingrown toenail and it gets rid of the thick toenail, all in one step. If you don't want the entire toenail removed, you can do a couple little procedures where you just cut the corner back, or a little more aggressive procedure where you take out the entire edge of the nail and then you put some medicine in there to make it so that part of the nail doesn't grow back and prevents an ingrown toenail from reoccurring in that spot.
I have the neuropathy, but I don't have no kids. I'm not a diabetic. I got the side effect of chemo.
Yep.
And my feet just feel dead all the time. They're not live.
I have it
Is
too.
it?
I have it too.
Yeah, chemo is very, very common.
Is there any medication I can take for that?
There are some over-the-counter vitamins that they say can help with the neuropathy, but like I said, it's pretty difficult to completely get it to resolve. But there are nerve vitamin combinations you can take that can help with that. Or even putting like icy hot or something on your foot. It helps kind of fool the nerves into, they get that icy hot feeling where it burns and it cools and the nerve thinks, what's going on here? I'm just going to ignore that nerve because it's freaking out over nothing, and that can calm that nerve sensation down.
What happens when a person has a toenail removed, but it looks like it's growing back? And he had another toenail removed and it's not growing back, but the other one seems to.
Yeah, so when we remove a toenail, there's 2 different things you can do. You can put a chemical in there that makes it so that nail doesn't grow back, or you can just let the toenail grow back and see if it comes back thickened again. The medicine is not 100% effective. We say it's about 95% effective at not having the nail come back. So it could be that either A, they didn't have the medicine put on the one nail and so it is actually growing back, or B, the medicine isn't effective on that toenail, which we do see very rarely.
When you say putting medicine on it, are you talking about the surgical removal of the toenail?
So if we were going to try and make it so the nail wouldn't grow back, right after we take the nail off, we then take some Q-tips and dip it in this chemical, and then we put that all over the base of the nail. If that wasn't done, the nail will come back for sure. Okay. Yes?
Didn't hear you address a foot that rolls. I forget the technical name.
So rolling in, so that would be an inversion. It could be that if you had a history of ankle sprains when you were younger or fairly active and you had some ligaments that are kind of stretched out a little bit, you can be prone to chronically rolling your foot in. If that's the case, I recommend wearing either an ankle brace at all times, a good lace-up ankle brace called an ASO ankle brace, or shoes that are kind of a higher top. But yeah, there's all sorts of different reasons on.
You don't do the, about over 10 years ago, I had something to insert in the shoe to kind of keep it from rolling.
Oh yeah, there's
So old, I don't know if they still do that or if they do something different.
yeah, it could be if your foot has a higher arch and you could be more prone to rolling your foot out. We recommend getting some inserts that are kind of built up on the outside of the foot to force your foot, instead of being like this, to turn it over a little bit to keep it from going over. That could be what was done. But yeah, certainly starting with shoe gear changes, inserts, braces to try and prevent those things. If it continues to happen and you continue to roll your ankle and have pain, there is surgery where you can actually go in and recorrect the torn or stretched out ligaments. Yeah.
I was wondering, over the years, I've noticed for pedicures, there's lots of places that are not as defined with doing pedicures like they did in the past.
Yeah.
And I was wondering if that was something due to complaints, suing, etc., or is it just cautious?
So I don't have a good answer for that, but I will say for pedicures, if you're going somewhere getting pedicures done, make sure that when they're getting the instruments out that they're going to use on your feet, that they're pulling those instruments out of a sealed package that looks like it's been run through an autoclave to sterilize it. You don't want them pulling stuff out of a wet soak or just instruments that they're pulling out of a drawer that haven't been sterilized. We see way too many patients that come in that say, I didn't have a fungus on my toe, but then I went and got a pedicure and now I do. If the place you're going to isn't using those instruments, you can buy your own instruments and clean them yourself, and that way you know it's only being used on your foot. You're not going to pick something else from somebody else. Just make sure their instruments are sterile. Other than that, I don't know about the pedicures. Yes.
Hold on,
Go
Jim.
ahead.
When I take my shoes and socks off and I squeeze my toes like this, it feels like crepe paper, not skin, but crepe paper under the toes.
Can't say I've heard that before. I don't have a good answer for you. Sorry.
You earlier mentioned bone spurs, and I think you stated that there's something other than that initial pain.
Yes.
Because I've had two in the past. I mean, and once those were taken care of, I had one under a toenail,
Okay.
and then I had one on the ball of my foot, and that was both were very painful.
Mm-hmm.
But once they were extracted or removed,
Yeah.
the pain went away.
Yep. So a lot of times the bone spur is the source of pain. Well, not a lot of times. It's not usually the source of pain, but if you definitely had one on a toe that was prominent in either direction, what I'm talking about is bone spurs on the back of the heel or the bottom of the heel. Patients are like, I've got a bone spur on my heel. Truth is that bone spur has been there for years and years and years because your tissue is tight over time and it's creating that bone spur, but then one day it starts to be painful. It's not painful because of the bone spur, because you've had that for years and years and years. It's just now painful because it's just overly too tight. But yes, bone spurs can be painful. If it's on a weight-bearing surface and pointing down, absolutely. Just usually it's not. Yes.
Bunions. I get magazines or I get catalogs that have apparatus to correct your bunion, make it straight again. Is that a good idea?
I personally would not recommend that to my mom.
Thank you.
I don't think it would do anything. Just if it's not painful, modify your shoes, wear shoes that have a wide toe box and are comfortable. I think those are, I don't want to use the word scam, but I can't think of a better word. It's not going to permanently correct it. Yeah.
Can you prevent neuromas in your foot by wearing a better shoe, a larger toe box?
Yes, so a neuroma, I guess we'll go here. This is an x-ray of my foot. I have a broken bone right here. It's been that way for years. It doesn't cause pain, so I don't worry about it. But what a neuroma is between each of these bones, there's a nerve that runs to the toes, and then it splits and goes to each side of the toe. A neuroma is, as the nerve is going through this little tiny spot right here where these bones are getting bigger, the tissue around the nerve or even the nerve itself just gets irritated and compressed in this area. If you're wearing shoes that are too tight, forcing all these bones to squish together, that's certainly going to irritate that nerve. Wearing wider shoes will help prevent the compression of that nerve. So absolutely, wide toe box shoes can help prevent a neuroma. Does it mean it's going to absolutely guarantee you won't ever get a neuroma? No, but it can help. And then,
How do you fix hammer toes?
how do you fix hammer toes? Well, there's different types of hammer toes. Basically, if the hammer toe is reducible, meaning you're sitting in the chair and I can just take it and completely straighten your toe out, you could do a simple in-office procedure that takes 5 minutes and just cut the tendon on the bottom of the toe that's pulling the toe like this. If you cut that tendon, the toe will straighten out. If you can't completely reduce it, then unfortunately it comes to surgery where you have to actually cut some bone and fuse bones together. It gets a little more complicated. About a 5-week recovery in a post-op shoe, but if it's simple and can be straightened out fairly easy, a real quick in-office procedure. If it's not a bad hammer toe and can be completely reduced, you can work on stretching the toe. So if my toe is like this, if I am just stretching it the opposite direction of how it wants to sit, you can stretch those tendons out a little bit. It's probably not going to correct it 100%, but it can help reduce some of that deformity and hopefully reduce some callus that you may be getting. But some surgery can usually help. Say that again?
Gout in your foot.
Gout. So gout is usually caused by diet, eating too many leafy greens or too much organ meat or red meat. Alcohol all contributes to developing gout. If you have it chronically, you need to see your primary care physician and get put on medication for it. If it's a flare-up, it probably means you had a good weekend and were drinking and eating a lot of red meat. Sometimes it just flares up on some people. There's medication you can take. We would, of course, want to do some lab tests to confirm that it actually is gout. But there's medication you can take to help with the pain and reduce your chance of getting a flare-up. If it's chronic and you cannot get it to go away, gout attacks the joint. And so if the joint is so painful, a surgery would be to go and remove that joint, essentially fusing bones together. You remove that joint, you remove the gout flare in that joint. Yeah. Or
I've had a foot doctor give me inserts before for plantar fasciitis. And that really, really helped.
yeah.
And I just didn't hear you say about inserts. But.
Inserts can work well. So plantar fasciitis, like I had said, it's usually caused from the Achilles tendon being too tight and it pulls down here and you get this pain right here with every step. You get inserts that are really well cushioned right there. It can take the pain away. Also something that has a little bit of an arch support can help hold this plantar fascia in a better position so it's not stretching out so much as you're stepping. Inserts absolutely do help, and we give them to people all the time for that. But if you are trying to avoid changing those, stretching is my _1 go-to treatment for plantar fasciitis. But yes, inserts are useful.
I originally got them from the podiatrist, but now I order them online, and they're just real similar.
Yeah, that's a good way to get them. Yes?
Can a callus on the bottom of your foot be surgically removed so it doesn't come back?
A callus? So there's a couple different types of calluses. Most callus, if it's a traditional callus, it's caused by pressure to that area. So first you got to figure out what's causing the pressure. So yes, we trim calluses in clinic all the time. But they tend to come back because the source of the pressure hasn't been removed. If you have a bone that's too prominent plantarly that's causing that callus, you'd have to remove a portion of that bone to remove that callus. If it's shoe gear related, if you're walking around barefooted and there's too much pressure from that, you need to change that. Yes, we can remove a callus, but if we don't change the root cause of the callus, it's just going to come back. Yes?
You referring to coming to the clinic. Do you have to be referred by your physician? Can you just come to the clinic? Do you have a history or?
So I'm not the right person to ask for that. Monica would know more than I do. I treat feet. I don't schedule patients to come see me.
You do not have to have a referral. You can self-refer. You can just call and make an appointment. So Dr. McKellar is in the office Monday through Friday, so he's taking new patients and happy to see anybody. We have 3 other podiatrists as well.
They
So
can't
pretty.
hear you. We need
Dr. McKellar's in the office Monday through Friday, so he's seeing new patients, happy to see anybody. We have 3 other podiatrists as well, so pretty easy to get in with them. Some of them go see patients at the wound center. Dr. McKellar is not doing that at this time, so lots of availability Monday through Friday. You do not have to have a referral from your doctor. You can self-refer. Couple things he mentioned, like we have a specialty nail care clinic, so certain patients that are diabetic, for example, that have routine care with their primary care that meet certain criteria to get nail care, like the trimming and trimming with the calluses, that can be covered by your insurance. But we also have a cash nail for those patients that don't qualify, that you can come in and, like he said, have a nurse trim your nails, trim your calluses, things like that. Any other questions for me?
So is that considered medical or cosmetic? Because that's kind of what the insurance decides, kind of like.
Yep, so nail care, depending on if you meet several criteria. So if you're a diabetic, so first you have to be a diabetic to qualify for specialty nail care. So if you do not have that first qualifying factor, then you would be able to come in and have nail care done and just pay cash. So nail care, did you want to add something to that? So you trying to grab this?
Yeah. So it's from my understanding, it's not just a diabetic. There's certain criteria you have to meet to have me or one of the other podiatrists trim your toenails. If you've had a history of a toe amputation, if you have peripheral arterial disease that's bad enough where we can't feel your pulses, you don't have hair on your feet anymore. There's certain things we look for, like color changes and splotching, bony prominences and calluses. There's all sorts of different things that we look at on our exam to see if you qualify. It's just most of our patients that do qualify happen to be diabetic. But you can have other reasons that would contribute to you qualifying. If it's just, I can't reach my toes anymore, which is a lot of us, we would say, come into our nail clinic and there's a $40 fee just to have one of the nurses cut your nails, but that's better than coming and seeing me and me cutting your nails and then your insurance saying, why did he cut your toenails? You don't need this. Here's the bill for the office visit. So if you don't qualify, your insurance will say, yeah, that's cosmetic, you're paying for it.
So an examination will be kind of done first.
Yes.
So just a little bit more to add to that. So like you said, most of the patients are diabetic, but there's so many qualifying factors. Thanks for clearing that up. So anyway, if you come in and see the podiatrist for any reason, they do a foot exam, that's when they know that you could come back in for specialty nail care. So that first exam, for any reason that you might come in, then they schedule you for that after that. Did you have something?
I just didn't know, for some of the crowd that may not be aware, like, is this something that if they had any of these problems, could they come to Owen for that as like an intro?
Yep, you could. So if you,
What was the question?
so Andrew wanted to know, we have an ortho walk-in at our building. So within our building, we're behind Frickers, so it's the Reid Health Comprehensive Bone and Joint Center. So we have podiatrists, orthopedic surgeons and providers, spine surgeons, and pain management in that building. So they all work really well together and collaborate. Our walk-in is open 8 to 8, Monday through Friday. So if you just had something that you happened that evening, or something flared up on you, like a foot-related thing, you could come into the walk-in if it's the only time you could get there, for example, if you need help with transportation or something happened. But you can easily get in with one of the podiatrists these days pretty quick, within a few days. So if it truly is a foot issue, I would recommend you see one of the podiatrists. But if it's like an acute injury or something that just happened with your foot, our ortho walk-in can help see you, get you some x-rays that we have on site, and then refer you to Dr. McKellar, who could follow up with your foot care.
But you don't give pedicures, do you?
No. I will cut your toenails and file them so they're smooth, but we're fresh out of nail polish.
They'll pay me for it.
All right, any other questions? Okay, thank you for your time.
Are we good? Can everyone hear me? Am I talking loud enough? Oh, hello everyone. I'm Lisa Felsman. It's so nice to meet you all. I think I've seen many of you walking through the community before, or maybe at Meyer or in different places. I work for Centerstone as a system of care coordinator, and I was delighted to be asked by our community benefit team to come and talk with you all about mental health, being that this is Mental Health Awareness Month. I adore our community benefit folks. They're so good to us. I cover 5 counties, and we get to do many fun things together, including parent cafes. We work together with the American Foundation for Suicide Prevention and different things. So really grateful to know our good Reid folks. Sherry especially, she has done so many good things. And I recognize some of you from maybe 10 years ago when I came to speak with Sherry's group that used to meet at the original Townsend Center, back when Katrina used to provide the delicious lunches with her caramel frosted cakes. So nice to see you all, so glad to be with you. I want to start by reading a poem to you by Mara Coleman, and I think many of you may be able to relate to this. It says, "What do women hold? What do women hold? The home and the family and the children and the food, the friendships, the work of the world and the work of being human, the memories and the troubles and the sorrows and the triumphs and the love." Women hold a lot of stuff, don't we? We carry so many things. That mental load is a real thing. Is there enough toilet paper? Do I need to get that prescription filled before we run out? There's so much things that we're responsible for. I don't know if how many of you have heard, but we're actually in an epidemic of loneliness right now. The Surgeon General has declared that we are living in an epidemic of loneliness. That feeling of, yes. Oh, you are so right. You are so right. People were so lonely, they died of loneliness even during the pandemic without having family to be able to come and visit with them, and no love and hugs and touch. It was really a challenge. And oh yeah, it was a huge challenge. You are so right. They really could, and I'm going to talk about that in just a minute. I'm so glad you brought that up, because that's part of being in a caring community, to be that person who can bring that love in. So in the most recent World Happiness Report, the United States fell, guess where? We fell from the 15th to the 24th place. So we're not even in the top 20 anymore. And part of that is because our young people are experiencing such depression and anxiety at levels of midlife crisis mode. We are struggling like never before. And many of us are very alone. We don't have a built-in support system of grandparents and extended family living near us like many of us used to. And many people are not involved in churches. They're not involved in active community groups where they can say, hey, can you pick up my kids? I've got something going on. I don't know. We don't have those go-to people like we used to in the old days. And that is a huge challenge. And it definitely impacts our mental health, because we feel like we're carrying everything, because we are. And it's really hard. And we really, especially for women, we often put ourselves last because there's everything else on the list. So I have a couple of takeaways that I'd like to leave with you today. When I worked for Birth to 5, I learned in the curriculum that I taught that we are the designer, the consultant, and the authority on our children, but also on ourselves. And so one of the takeaways I want to leave you with is, please care for yourself like you would for someone who you deeply cherish. Talk to yourself like you would to someone you deeply cherish. How many of us are guilty of talking to ourselves terribly and having expectations of ourselves that no one could ever accomplish, but we expect that for ourselves. We think, oh, I'm such a failure. oh, I'm just not doing what so-and-so is doing. And we're carrying a lot. That mental load is always with us, and yet we still feel, oh, I'm just not doing good enough. And it is a challenge. So stop talking to yourself like that. One of the things that we tend to do is we put off and put off because we're scared. We're scared to go to the dentist. We're scared to go to that specialist because what if they say something's wrong? I know for me, unless the pandemic would have happened, I might not even be standing here because I was the last one to leave every day. I wanted to get my work done. I was a workaholic, and I ended up going to the dentist, and the dentist said, we're not treating you until you get your blood pressure under control. So that forced me to find a primary care physician, to get on blood pressure medicine, to find out, no, you don't have cancer, you're not dying, you have a terrible vitamin D. Your vitamin D is supposed to be at a 30, mine was at a 9. So, I mean, we need, if I would have gone earlier and gotten that taken care of, I would have felt better, but I didn't make the time to do that. I did not care for myself like I should have because I had all the other stuff going on. So, do that good stuff and take care of yourself. Get your preventative care. We all know we do better when we like the people who are taking care of us. When we feel safe, when we feel good. If you don't like your doctor and you don't feel like they're listening to you, see who else you can talk to. And especially with a therapist or a case manager or a counselor, when you like those people that you're working with, you're going to want to meet with them. You're going to listen. You're going to be bought in. So you like the people you're working with and build your own power team of people that will help you be your very best. You deserve it. And we all do better with those people that we love and trust. Dental, primary care, therapist, case manager, banking, financial people, all of those folks. We need to be with people that we feel good about. Something else that we can do is we can treat ourselves. In the goodies, the giveaways, I brought some special extra ones. Candles, I love burning candles in the evening especially. Good coffee, I love that. Reading books, I love to do that. I am a perfumeaholic. I love to smell good, and I love collecting perfume, so that's going to be in the giveaways too. And I thought, why not? We're not getting any younger. Why not treat ourselves and enjoy and really feel good about ourselves? So I think that's so good. So the thing that I brought for you to look at, this is a behavior scale. Everyone at Centerstone gets trained in this curriculum called WELL. And what this does is this really, if you flip over to the second page, it shows you, oh no, these are signs of agitation, being disruptive, destructive, etc. So one thing that we say, let's build in green. And if I could have given you a color version, you would have seen that the top of this Lallemand behavior scale would have been red. The bottom of this behavior scale would have been green. And so this front page, this is all the green. So there are numerous ways that we can feel better and do better. We can be part of a caring community, like our friend said. Visit our friends at nursing homes. Hug them, kiss them, bring them flowers, bring them soft, cozy things to wear. We get so lonely, and that epidemic of loneliness is a real thing. We're isolated. We are on our phones way too much, and we... The algorithms are built to make us stay on our phones even longer. So being in person with people, that's such an important thing to be able to do. So if you look at caring community, family, friends, neighbors, coworkers, church, people in common interests, to remind us, people care about me. I care about others. I enjoy being around others. So creating opportunities, model likable behavior, supporting the stretch, and that means when you're doing that with others, they're seeing that, and then there's a ripple effect that comes from that. And some of you may be retired, and you may have a neighbor, or you may have someone in your circle where you think, that kid doesn't seem really happy. I wonder what I could do to make a difference here. Maybe I could invite them to Roscoe's and we could play Uno or something like that. Some of the research says that every child needs one special adult in their life, and that can make all the difference. And you could be that person. And sometimes all it would take would be for you to reach out and make that connection. Their parents would be thrilled to have somebody else in their sphere reaching out to them. Productivity, we need to matter. We need to have a reason to get up in the morning. So thinking about what would I like to be involved in? Let me find a way to be part of that. High quality relaxation. I feel great when I can thrift shop. Do you guys like thrift shopping? My whole outfit is from Goodwill. I love a good bargain. It makes me feel so good, and it also makes me feel good that I'm saving money and I'm doing a great thing for the environment because it's not going to the garbage. So, I think all of those listed could be great, and you can make your own list here on this second page. So. I also wanted to share that there does come a time where sometimes you do need to find some extra help. If you're feeling really overwhelmed and exhausted and miserable and like things are not getting better, reach out and talk to someone. You deserve to feel better, and you can feel better. And Centerstone and Meridian are a great place to start. There are also a lot of local private therapists that you could talk to. There's also the 988 hotline that you can call, or you can text, and they can give help. So I just wanted to encourage all of you to care for yourself like you would care for someone you truly love. Build your power team, treat yourself and build in pleasure, and hopefully everything will continue to get better. So wonderful to talk to you today, and wish you all the best. Oh, I see.
Okay, we'd like to thank everyone for joining us this month. And on your way out, please take your lunch.